Bon vendredi à tous, tout le monde.
Happy Friday to everyone.
In many other countries, COVID-19 cases are still rising. Yesterday, both British Columbia and Saskatchewan announced a record high of daily new cases. On Wednesday, Ontario reported their largest number of new COVID-19 related deaths in a single day since the beginning of the second wave. I can't stress this enough. This situation is serious. These are not just numbers. These are people's grandparents, parents, and loved ones. We all have our own reasons, our own loved ones that we want to look out for and protect. I just got news last night that my godfather and uncle, Tom Walker, had to be readmitted to hospital last night. He's been in and out of hospital over a while, and I'm sending him my love, and we're all thinking about our loved ones who we haven't been able to see for many months, who we're worried about. We all have our reasons to keep each other safe, to follow public health advice. We need to do that. It's particularly nice outside in many parts of the country this week, which means we're still enjoying lots of fresh air. But winter is coming, and that means we're going to have to get into more enclosed spaces. We're not going to be able to open windows wide in rooms. Ventilation is going to become much more important. We need to remember to be careful. There is increasing evidence that aerosol spread is a vector of transmission. We need to wear masks. We need to avoid crowded, closed spaces, as Dr. Tam has said many times. We need to make sure we're making it into winter on a good footing so we can hold on through winter. The vaccines hopefully will be here in the spring, but there's a lot of work to do between now and then to make sure that we're keeping Canadians safe and healthy. That's the work we need to continue to be determined to do. We need to continue to be there for each other. So continue to follow local public health guidelines. Wear a mask, keep your distance, and download the COVID-19 app. Les cas de COVID-19 continuent d'augmenter au Canada.
COVID-19 cases are continuing to increase in Canada and around the world. I would like to be clear, the situation is serious. Now is not the time to let down our guard. This week we saw a number of record cases in different areas of the country. Quebec yesterday had 1,038 new cases. Think of your loved ones, frontline workers, the most vulnerable people. Together, we can help protect them by following local public health authority guidelines. We will continue to wear masks, keep our distance, and download the COVID-19 app. It's beautiful outside these days in many parts of the country. We can continue to stay outside, but in a few weeks, winter will come, and we will have to be inside increasingly in areas that are less well ventilated, in areas where we can't open the windows. We'll really need to be careful. We'll need to do everything we can today to prevent outbreaks of COVID-19, to head into winter in a better position than where we currently are, to be able to get through winter knowing that spring will be better and summer even better again, hopefully with new vaccines. So hang on, let's be there for each other. We all need to follow public health authorities' instructions. We must continue to do our share, each and every one of us. The government is continuing its own efforts. In the last week, we sent $3.5 million gloves to the territories to continue in the help them with their support, and we're continuing to send out rapid test kits. In the last week, more than 2.8 million rapid test kits will distribute it, and more will follow.
Keep Canadians safe. We're also working hard to keep Canadian jobs. This morning, we received the news that 84,000 jobs were added to the economy in October, mostly full-time positions. This means over 2.3 million Canadians have returned to work after they lost their jobs during the pandemic. We're making progress, but there's still much more work to be done. The technology and innovation sector is and will continue to be a key tool in creating good jobs and rebuilding a stronger, more competitive economy. In April, we created the Innovation Assistance Program with the National Research Council of Canada to support innovative businesses, including pre-revenue firms that were not eligible for the wage subsidy. This investment helped small and medium-sized Canadian businesses keep 24,000 employees on the payroll. To continue supporting these companies and the people they employ, I can announce that we are extending the Innovation Assistance Program with a new investment of $155 million. High-potential, innovative firms are key drivers of economic growth, and we will be there to help them bridge to the other side of this crisis. Aujourd'hui, j'annonce un investissement de 155 millions de dollars.
Today, I'm announcing an investment of $155 million to extend the Innovation Assistance Program of the National Research Council of Canada. This program supports small and medium-sized businesses in the innovation sector, including pre-revenue firms that are not eligible for wage subsidies. Following the creation of this program in the spring, the Innovation Assistance Program allowed small and medium businesses to save $24,000 jobs, and it will help our economy remain competitive. The government is here to help those workers get through this crisis. Minister Baines will go into detail on this investment, but I'd first like to talk about our efforts to encourage scientific research across Canada. Our researchers must have access to the necessary resources to do their job. Thanks to the exceptional innovation fund for COVID-19, we have investments of $28 million to help COVID-19 related projects. For the Cégep André Laurendeau team, for example, 3D technology is being used to help with social distancing measures. At University of Calgary, other researchers will be able to use new microscopes at the cutting edge of technology to study the effect of COVID-19 on blood, on blood. This fund is helping institutions across the country, colleges, universities, and so on, in order so that they can better do their research and advance science.
I want to end today by too. In many parts of the country, right now you might be asked to stay home and limit the number of people you see as much as possible. I know we all miss getting together with friends, colleagues, and extended family. It's not easy. So if you're feeling anxious, or if you're struggling with mental health or other challenges, pick up the phone and reach out to someone you can trust. You can also always call 211, a 24-hour helpline that will connect you to the right resources. It's free and confidential, and they can help you in more than 150 different languages. Merci. Prenez soin de vous. Passez une bonne fin de semaine.
Thank you. Take care of yourselves. Have a good weekend. And I hope you have a good Veterans Week. Mr. Baines, Minister Baines.
Thank you very much, Prime Minister. Since the early days of the global pandemic, companies have been stepping up to lend a hand wherever possible, and the Prime Minister has highlighted that often. And I've been consistently impressed with the enthusiasm and capacity of Canada's innovators to rise to the challenges that we face as a nation. Et le gouvernement travaille pour soutenir les entreprises canadiennes.
The government is working to support Canadian businesses during this crisis.
We've been working hard to support Canadian businesses during this time of crisis. Our government has already brought forward measures like the Canada Emergency Wage Subsidy to keep people working. We're helping businesses that are facing cash flow problems with the Canada Emergency Business Account. And we introduced the Canada Emergency Rent Subsidy to help with one of the biggest costs faced by small and medium-sized enterprises, And I participated in the debate last night where we're working hard to advance these very important measures so we can implement them and that these businesses can receive these supports. And today, we're announcing, as the Prime Minister has indicated, through the Innovation Assistance Program, a support measure that will inject $155 million to help protect Canada's highly skilled innovators. It's about keeping Canadian talent here in Canada. It's about investing in our #1 resource. Since we first announced this program in April, the Innovation Assistance Program has helped over 2,000 companies, but also, again, as mentioned by the Prime Minister, support more than 24,000 jobs. Ces petites et moyennes entreprises innovatrices sont des...
These innovative small and medium businesses are the driving force behind long-term growth and high-quality jobs. This is especially the case in Canada, where innovation and science are assets.
Early stage firms, we not only protect the next generation of Canadian entrepreneurs, but we also employ the necessary resources to make sure they can succeed. And we help ensure that innovative Canadian technology and research stays in Canada. So today, we're also providing new funding for equipment and tools to ensure our researchers have the support necessary to do their jobs, especially in trying times. The $28 million in research infrastructure support adds on to the ongoing research related to COVID-19. And this funding will go to support 79 different projects at 52 universities and research hospitals, colleges, polytechnics, and CEGEPs across Canada. So it's incredible to see that entire network engaged. There was one project that I want to highlight, the one by Dr. Mary DeMarco and her team at the University of British Columbia, that is researching how COVID-19 damages the human's lungs and heart tissue. They're examining how the virus genetic code will affect the severity of the disease. And they're developing new innovative diagnostic tools that will easily detect the virus. So all of this is important to support science, research, and innovation. And this will help us build back better. And now I'd like to pass it on to Dr. Tam. Thank you.
Bonjour and bon après-midi à toutes et à tous.
Hi, and good afternoon, everyone.
51,338 cases of COVID-19 in Canada, including 10,381 deaths. Nationally, there are close to 33,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 61,000 people daily, with 4.7% testing positive. The average case count is now over 3,350 cases reported daily over the last 7 days. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average 1,200 individuals with COVID-19 being treated in Canadian hospitals, including 225 in critical care, and an average of 44 deaths were reported each day. As I mentioned earlier this week, I am cautiously optimistic that safe and effective COVID-19 vaccines will be available in the first quarter of 2021, bringing us one step closer to the widespread and long-term management of COVID-19. I would like to emphasize that when vaccines become available, there will be a limited supply at first. While that supply will continue to increase over time, it does mean that federal, provincial, and territorial governments will have to make important decisions on how to use the initial vaccine supply. The National Advisory Committee on Immunization, or NACI, is a long-standing expert advisory group that provides independent guidance and recommendations to inform these kinds of tough decisions. On Tuesday, NACI provided preliminary guidance on the key populations that should be considered for early COVID-19 immunizations, including people at high risk of severe outcomes or those at high risk of spreading to them, workers essential to maintaining the COVID-19 response or other essential services for the functioning of society, and people whose living or working conditions put them at elevated risk of infection and its disproportionate consequences, including Indigenous communities. The full guidance is available at canada.ca. While this preliminary guidance is helpful for planning, there is still a long road ahead. Clinical trials need to continue, Health Canada still needs to approve the vaccines if they are deemed safe and effective. And we will be receiving additional advice that we know to be effective in keeping infection rates low. Stay home if you have symptoms, even mild ones. Wash your hands frequently, maintain physical distancing, wear a mask when spending time indoors with people from outside your immediate household, and avoid or limit time spent in closed spaces, crowded places, and close contact situations where you can't consistently maintain physical distancing, what we've been calling the 3 Cs. I remain committed to keeping Canadians informed and to share new information as they become available. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. There have been 251,338 cases of COVID-19 in Canada, including 10,381 deaths. Nationally, there are close to 33,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 61,000 people daily, with 4.7% testing positive. The average case count is now over 3,350 cases reported daily over the last 7 days. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average 1,200 individuals with COVID-19 being treated in Canadian hospitals, including 225 in critical care, and an average of 44 deaths were reported each day. As we mentioned earlier this week, we are cautiously optimistic that safe and effective COVID-19 vaccines will be available in the first quarter of 2021, bringing us one step closer to the widespread and long-term management of COVID-19. We would like to emphasize that when vaccines become available, there will be a limited supply at first. While that supply will continue to increase over time, it does mean that federal, provincial, and territorial governments will have to make important decisions on how to use the initial vaccine supply. The National Advisory Committee on Immunization, or the NACI, is a long-standing expert advisory group that provides independent guidance and recommendations to inform these kinds of decisions. On Tuesday, the NACI provided preliminary guidance on the key populations that should be considered for early COVID-19 immunizations, including people at high risk of severe outcomes or those at high risk of spreading them. Workers essential to maintaining the COVID-19 response and other essential services for the functioning of society, and people whose living or working conditions put them at elevated risk of infection and its disproportionate consequences, including Indigenous communities. The full guidance is available online at canada.ca. While this preliminary guidance is helpful for planning, there is still a long road ahead. Clinical trials need to continue. Health Canada still needs to approve the vaccines if they are deemed safe and effective, and we will be receiving additional advice on prioritization based on the characteristics of each vaccine once approved. In the meantime, it is crucial that we continue to layer on individual protections that we know to be effective in keeping infection rates low. Stay home if you have symptoms, even mild ones. Wash your hands frequently. Maintain physical distancing. Wear a mask when spending time indoors with people from outside of your immediate household. And limit time spent in the 3 Cs, closed spaces, crowded spaces, and close contact situations when you can't consistently maintain physical distancing. We remain committed to keeping Canadians informed and to sharing new information as soon as it becomes available. Thank you.
Thank you, Doctor. We'll now turn to the phone for questions. One question, one follow-up. Operator?
Thank you. Merci. If you have a question, please press *1 on your device's keypad. Si vous avez des questions, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. Première question, Lina Dib, La Presse canadienne. À vous.
First question for the Canadian press. Hello, good morning. Mr. Trudeau, I'm not here, so I can't see you all there. But on Tuesday, Dr. Tam and Dr. New gave new guidance with regard to three-layer masks inside. I'd like to know why you're not wearing a mask when you're speaking. You're inside. And I'd also like to know if you believe that parliamentarians should also follow this guidance. That is, should the rules in the parliamentary precinct be changed, particularly in the House of Commons? And if not, why not? Answer. Thank you, Lena. We know that the behavior when we're inside is very important in terms of guidance. You may not have noticed, but I try to wear the mask even in the press conference if I'm not speaking, but I take it off so that I can speak clearly. Some journalists here are wearing the mask when they're at the mic. It's important to follow the guidance in every situation in which we find ourselves. So we'll continue to do what we can. I believe that this question can be asked about parliamentarians who are in a closed space. We'll have to examine the ventilation at the House of Commons. It's nonetheless a very big space, but these are exactly the types of questions that we should be asking ourselves. When we enter a closed space, we should be keeping the 2 meters distancing and keeping a mask. If there's not proper ventilation, it would be important to wear a mask. I know that these are additional instructions. I know it's complicated for people, but it's important to do everything we can to prevent outbreaks, COVID-19 outbreaks.
It's important for all of us to try and follow the best public health advice possible. I have, over recent days, taken to trying to wear a mask anytime I'm inside, including when I'm more than 2 meters distance from people, when I'm not actually speaking. This is an extra degree of protection, but it's an extra onerous step that many of us are going to have to take on. But we all need to do what we can to slow and stop the spread of COVID-19. Obviously, everyone's situation is different, the contexts are different, but using our best judgment and making those little sacrifices so that we don't continue to see mounting losses and increased disruptions from spread of COVID-19. We've seen many of our allies in Europe have to go into severe lockdowns, impose curfews. We've been able to avoid that in Canada so far, right across the country during the second wave, because in general we have been acting quickly and because the federal government has been there to provide support to individuals and businesses that allow public health authorities to go ahead and act quickly to prevent further spreads.
Oui, merci.
Follow-up question. I don't understand the logic of removing your mask to speak. Since the very beginning, Dr. Tam has said that it's when we speak, when we're singing, when we're yelling, that we're more likely to transmit the infection if we're sick. So I don't understand why you're removing your mask to speak. Perhaps Dr. Tam can explain the logic behind this. I'll be happy to let Dr. Tam provide expert advice, or Dr. New. Answer, Dr. New. This is Dr. New. Of course, if you're speaking or singing in a closed space and there's not proper ventilation for a long period, there is an increase in risk. But I think we need to be practical as well. As the Prime Minister has stated, we want to be able to communicate clearly. These are a few minutes in a press conference just to be able to answer questions when using the microphone. I think that's fine to be able to answer questions without a mask. But if someone else is speaking, then we wear our masks. It's not just wearing a mask that it's important. It's very important to underscore that all the instructions are necessary for every single person. Good hand washing, physical distancing. Wearing a mask is another layer of protection in among all these public health measures. And I think it's a habit that everyone should adopt as a regular habit. As soon as you leave the house, of course, in the winter you're wearing a toque, mittens. Now, when you go inside, you should be thinking that you should be wearing a mask. If you're in a public space or even in a private home where the people in that home are not part of your family bubble or home bubble.
Merci. Prochaine question. Operator.
Merci. Prochaine question, Émilie Bergeron, Agence.
Next question, Emily Bergeron, QMI Agency. Question. Yes, my question is for Mr. Trudeau. The comments that we heard yesterday from Mr. Trump, he's talking about election fraud without any basis, any facts. Do you think these comments are dangerous for democracy? Do you think that this is he's inciting people to be violent? Answer. The U.S. has been managing its elections very well for decades and even centuries. We have faith in the American people and the American institutions to have elections take place properly. It takes time to count the results. This is something that's foreseen in the American process. On our side, in Canada, my priority is to always ensure that we're here to defend the immediate interests and long-term interests of Canadians, and we will always do so. Follow-up question. I'd like to hear about the amendment proposed by the Bloc Québécois. The Bloc Québécois wants the Canada wage subsidy to be prohibited to political parties. The Liberal Party and the Conservative Party have stopped receiving it. Are you in favor of this amendment then? Answer. During the first wave of the pandemic, we were here to support businesses, organizations, and people who had lost their income because of COVID-19. Now, we are relaunching the economy, restarting the economy with targeted measures. The same supports are not as necessary during this second wave, and we are examining the Bloc Québec amendment and we'll make a decision. Next question.
Operator.
Thank you. Merci. Next question, Corey Seegers, CBC Edmonton. Line open.
Hi, thank you. Dr. Tam, as we're in the second wave and we're seeing numbers rise in different areas of the country, and different provinces are implementing different public health measures, is there ever a point where Health Canada would consider stepping in and issuing national public health measures or recommendations?
I think our role has been to provide guidance, and I think we recognize that it's the provinces and territories that implement guidance. So, and they are taking into account their local epidemiology and their particular capacities and circumstances. So that's how it actually works. Obviously, if you know, there's some extraordinary need, there are different tools that the government, in fact, the prime ministers and others can take. But really, you know, we've already flattened the wave once. we know actually much more about what we can do about the virus. So I think the making sure Canadians are brought along the whole continuum of working together with public health and governments to deal with the resurgence. I think that's the most effective and appropriate way of managing. So, and we didn't want, as public health officers with the other chief medical officers, to get that balance so that we don't blanket cover the country with the same public health measures, but try to use a more targeted approach. And that's still currently the approach, but it needs everybody to work with that. So if the balance is tilted and the public health system is overwhelmed, then some of these more restrictive measures are coming in. So measures.
And a follow-up, Corey?
No, thank you.
Okay, thank you. We'll turn to the room for questions.
Good morning. Prime Minister, notwithstanding, sorry, Tonda McCharles with the Toronto Star, notwithstanding your comments in French on the election, I'd like to hear you comment on the preliminary findings by the Organization for Security and Cooperation in Europe, the OSCE, did an international elections observer preliminary report on what's going on in the U.S. And they basically condemn the conduct of some of the practices there and saying, baseless allegations of systemic deficiencies, notably by the incumbent president, including on election night, harm public trust in democratic institutions. Do you agree or not agree with that report? What's Canada's position?
I'm not going to comment on a preliminary report. I'm also not going to comment on an electoral process that is unfolding in the United States as we speak. My focus is on ensuring that we are there to protect Canadian interests, to stand up for Canadian values, and we will continue to do that.
Juliane Lapointe, Radio-Canada. Donald Trump.
Radio Canada. Question. Donald Trump has made it clear that he doesn't trust the American election process. Do you trust it? Answer. We are watching the election process unfold in the U.S. This is a process that takes place every 4 years or every more frequently. I know people are eager to see the results, but we're confident that the American processes are taking place as they should. We will continue to take a close look at what's happening in the States, but I don't want to comment right now.
We are watching, as everyone is, the processes in the United States unfold as their electoral process is underway. We will continue to have confidence in the American institutions that have managed their electoral processes over many decades and indeed centuries. But we will continue to be alert so we can ensure we're protecting Canadian interests and Canadian values in regards to our closest trading partner and nearest neighbor.
Hi, Prime Minister Tom Perry with CBC. I know you're talking about the electoral system working down in the United States. What do you need to see before Canada congratulates whoever wins this election? I know that there doesn't have to be a concession by the losing candidate. So what do you need to see before you say, this person's the winner, congratulations?
Well, I think it is extremely important in electoral processes around the world that they be able to unfold in an appropriate way without foreign interventions or interference with the elections. We always think about the concern about hostile actors interfering or intervening in electoral processes, but even friends can have an influence on public discourse around internal processes that are key to defending democratic institutions, and that's why we're going to remain very cautious about making any pronouncements in regards to the electoral processes in the United States until the outcome is sufficiently clear. Je pense que c'est important que...
Answer repeated in English. I think it's important that the electoral process in various democracies can unfold appropriately without foreign intervention or interference. Obviously, we can all understand that there may be hostile actors who wish to intervene or negatively influence democracy in foreign countries. They should not be allowed to act. But even friends and allies may want to influence or the electoral process or the perception of the electoral process. And we need to be very careful. We will be very vigilant before, or be very prudent before commenting the election results.
Premier Doug Ford has said that he's considering legislation to prevent companies like Whole Foods from prohibiting employees from wearing poppies in the workplace. Would you consider something similar on a federal level?
I think Whole Foods has made a silly mistake that I am hoping they will correct very quickly. Our Minister of Veterans Affairs, Lawrence MacAulay, has engaged directly with them to highlight that they made a mistake and they should change course. This is something we see every year almost. Some company, some organization, some retail store makes a mistake around support for the legions or the wearing of the poppies, and it is quickly corrected due to public outcry. I think that is certainly what I hope will happen in the coming days. Je pense que on sait tous que
know that Whole Foods has made a mistake in prohibiting the wearing of the poppy. I hope that this company will change its mind very quickly. Minister Lawrence MacAulay, who's Minister of Veteran Affairs, is currently in touch with the business to talk about this error. And this is something that we see every year. A company, a store, an organization imposes rules that limit the wearing of poppies, and they quickly change their minds afterwards. And I hope that that's what we'll see very soon with Whole Foods.
Prime Minister Stephanie Levitz from the Canadian Press. Excuse me. There are now about 450,000 people in the country who've been out of work for 6 months or more. And we know the longer they stay out of work, the longer they're going to remain out of work. And for young people especially, it's a longer hit on their longer term earnings. So people would like to know, besides infrastructure spending, when will they see jobs? What is your government going to do to provide those jobs, and how fast are they coming?
I think one of the most important things that any society can do, any country can do when you're hit with a pandemic like this is be there to support people. And that's what we did from the very beginning. When the first wave hit, we were there to replace lost income with the Canada Emergency Response Benefit. We were there to support businesses large and small with the wage subsidy, with the CEBA business account, with the various measures on rent supports. We have been there for Canadians, and we will continue to, because many, many Canadians have lost their jobs because of COVID-19 and are continuing to struggle. We made a commitment in the throne speech that we were going to create 1 million jobs going forward to get Canadians back to work. And we're looking at the investments we need to make in order to do that. But at the same time, we've seen from examples, for example, in other countries like in the United Kingdom, where trying to restart the economy too quickly, trying to get people back to normal in an accelerated fashion before we have completely controlled COVID-19, has left them in a worse position. They've now had to do a full nationwide lockdown and brought in extra measures that have really set back that economic recovery. We're not going to do that. We are going to stay focused on supporting people as long as we need to, as long as they need us to, through this pandemic, so that when we come out of it, we're going to be able to get things back to normal quickly, have our economy come roaring back, and be there to build back better. But we can't do that until we get through this pandemic, which is why it's so important for people to continue to follow public health advice and know that your federal government is there to have your back, to support you, whatever it takes, as long as it takes, until we get through this pandemic.
David Aiken, Global News. Good morning, everybody. I think I heard Dr. Tam this morning earlier say, this is a question for the Prime Minister, speaking about vaccine distribution, that federal and provincial governments may have to get involved. And I'd like to hear your thoughts about the federal government is procuring vaccines. Will it distribute it to provinces on a per capita basis, on a needs basis? Who makes those decisions? Will Parliament get a chance to weigh in? Will the premiers? Can you tell us a little bit about how the vaccine triage is going to work?
Obviously, obtaining vaccines for Canadians is a top priority for this government. From the very beginning, we put forward a vaccine task force, which is constituted of professionals and scientists who are weighing in on many of these particularly delicate decisions about which vaccines to pursue for Canadians, which distribution manners are going to be best, which populations need to be vaccinated first in the beginning when we have limited supplies of vaccines. All those decisions will be based on the recommendations of experts. The federal government has moved forward on procuring access to a large suite of different potential vaccines from around the world, different types of vaccines, different origins of vaccines, because we know that making sure we're maximizing the chances of having the right vaccine for Canadians is what Canadians expect. And indeed, we have one of the best potential vaccine portfolios of any of our peer countries right now. And we're doing that at the same time as we recognize that we don't get beyond this in Canada unless the world also gets beyond this, which is why we're part of the COVAX facility that ensures that there are supplies for vaccines for the developing world, even as we're securing supply for ourselves. The decision on how to roll out vaccines will be discussed by the vaccine committee of experts, but also it'll be a conversation with the provinces. We know that some of the first vaccines to come out have extremely high degrees of logistical support necessary, things like freezers that can keep the vaccines down at minus 80 degrees Celsius, for example, which doesn't lend itself to mass distribution in pharmacies across the country, for example, but later vaccines that will be arriving will be able to do that. So we have to have a very sophisticated plan to be able to roll out vaccines the right way, the right vaccines in the right place to the right people. There are many means, the most vulnerable, Indigenous peoples, frontline health workers. These are the kinds of populations we're looking at for their high degree of vulnerability. But of course, those are conversations that will be had amongst provinces and territories and including experts. L'approche sur les vaccins
Answer repeated in French. The vaccine approach has been essential to our government since the very beginning. We know that we won't get through this pandemic without a vaccine or treatments, and vaccines will be coming in the months to come. We need to prepare. The federal government will purchase and pay for these vaccines, and we can't reach agreements with a large number of companies currently researching and producing vaccines. We are reaching agreements with these companies, and then when we receive them, we will also be ensuring that vaccines are distributed to developing countries. We need to put an end to this disease not only in Canada, but around the world. Once we have the vaccine, the questions of who and when, well, it depends on the type of vaccine. The first vaccines that we receive may need to be frozen at minus 80 degrees Celsius. That is a very strict requirement that will require special handling, special supply chain, logistics. We'll be working with the provinces on their capacity to obtain this equipment, the necessary equipment. Now, who will be the populations that will be vaccinated first? The most vulnerable populations, Indigenous peoples, frontline responders, healthcare workers. If we come up with vaccines and give them to the most vulnerable, that will allow us to change and modify the behavior of people who don't receive the first vaccines. We know, however, that vaccines will come over weeks and months, and we need to be able to react to ensure that all Canadians are protected. There's a lot of thought going into this on the part of our vaccine task force made up of experts. They are providing scientific and medical advice to ensure that our approach is the best one. We'll continue to work with our allies around the world and our partners to ensure that we're doing everything we can to put an end to this pandemic as soon as possible.
This morning, the ministers and doctors will stick around for further questions.
I just want to say that I am only here for another 10 minutes. Dr. New will continue to answer those questions. Thank you.
Can I start? Just a question for Dr. Tam. This is to you because I think earlier this week there was new advice on masks that a 3-ply mask may be now more preferable. Some of my colleagues, and that he's been talking to manufacturers of polypropylene cloth, and they say that unless it's medical grade, they would really not advise their customers to be putting everyday polypropylene cloth close to your face. You're going to get a lot of chemicals. I wonder if you could speak specifically to polypropylene as one of the plies in a 3-ply mask.
Yes, so given the resurgence in cases and people all going indoors, I think recommendation of adding another layer of protection is important at this time. So we actually did some research at the National Microbiology Lab on the external 2 layers, if you like, the cotton, because it's actually really impressive because the virus doesn't really survive on cotton for very long. So that was important to us. That's a bit different from maybe some of the other international guidance as well. The poly people could use. The polypropylene has to be unwoven polypropylene. So it's the simplest access to them is the sort of interfacing that people use to when you're sewing or making garments. So that's been the advice. I'm not the expert in this area. That based on consultations and looking at the evidence, that's the kind of polypropylene. But it is important to get some precision as well. And so I think that's the unwoven aspect of it is important because that's how you trap the particle, basically. And based on the technical team at the agency, that interfacing material is, easily accessible and is safe to use.
Dr. Tam, Tonda McCharles, Toronto Star. We've literally been asking you since March about aerosol transmission. The nurses have been asking since March, but this week you quietly changed the guidance, no big announcement. I'd like to understand what resistance you faced within your own circles to making that announcement and taking the precautionary step months ago of advancing the idea of aerosol transmission and the need to take more precautions. Why was that all just landed quietly this week?
If you were at my press briefing, I talked about aerosols on Tuesday. But we've been talking about aerosols, Dr. New and I, for quite some time. The range of droplets, some of them are small, some of them are bigger. And I believe it was around June, we made a big push for the message on the 3 Cs, the closed, crowded environments where there's, people, that's the context for some of the epidemiologic evidence on the bigger clusters, or some people call super spreading events. So that's the so what of do aerosols make a contribute is really about avoiding the 3 Cs. That was really important, and adding layers of protection like wearing a mask. Physical distancing still matters. Just because you're wearing a mask, you still have to as much as possible physical distance and avoid these 3 C's. So we've been out with that message, quite consistently for some time. So the international discourse on the role of different size droplets has been ongoing for some time. So that's important. But I do think, in general, there is in recognition that droplets of different sizes will play a role. How much or how important a role is played by the smaller size droplets or the aerosols still remains an area of research. But there are circumstances, such as in some of those outbreaks in the choir setting, in a particular workplace in Asia, in gyms, those kind of areas where people are shouting or talking loudly in an enclosed environment with poor ventilation. So really, the advice hasn't really changed, but because we're getting into the fall and winter season, we can't go outdoors because that's where aerosols get diluted, or open windows as easily. It's important to look at what more we can do. So, we've been engaging other scientists, more multidisciplinary scientists, including people who are more engineers and HVAC specialists and others, to look at, should there be advice for people to make sure the HVAC system works appropriately? What other advice can we give the general public? So we've provided some advice in terms of increasing the mix of outside air for your home as much as possible using your system. And we will be continuing to discuss with experts in this area. Many countries have been discussing these things, and the question is what additional measures people can take. Adding the mask is an extra layers, is just more extra layers of protection. I think that's prudent at this time, given the cases are going up, and it's winter, and it's people have to go inside. So a lot of, but it's true that in the scientific domain, not everybody agrees all the time. That's just science, that's normal. And the evidence is epidemiologic as well as some laboratory, engineering kind of sciences. So taking all of that into account and the context that we're in at the moment, it's important to really re-emphasize the 3 C's and the HVAC area. Now, in terms of the health workers, we had a couple of exchanges, I think even in the last while with you personally, and the agency's guidance is very permissive in terms of personal point of care risk assessments. And I really strongly believe healthcare workers have to be given the equipment that they need to protect themselves. So because they all work in slightly different environments, they need to be able to make those point of care risk assessments. And if they needed a respirator or if they needed a procedural mask, that has to be done at that point in time. So, but we will, honestly, we will continue to engage different disciplines and, have another look at whether further measures are needed. So, I certainly go into this not by myself. There's a lot of different scientists, and some of them may express different perspectives, but I do think we can come to consensus on a number of these things. So, so I think in the context of COVID-19, and people are just seeing out these discourse playing out in real time, essentially. But we're just trying to offer some sensible advice as we're going into the fall resurgence.
And what sensible advice then you have to workplaces in terms of investment in ventilation and what they need to consider before they bring workforces back into their workplaces? I mean, there are many buildings, new and old, where you can't open windows. What are you saying to employers around the country?
Well, I think many workplaces have reopened and followed guidance, including physical distancing, wearing a mask, hand washing, all of those things, and physical, environmental, administrative procedures so that people can reduce the risk. So, the advice on different types of ventilation is something that we have to look at. We provided some preliminary suggestions for everyone, which is to get your HVAC system reviewed, serviced. But there are other, standards I think people need to look at and engaging standard-setting organizations. But, this is an evolving area of, I think, guidance, and we'll just keep continuing to do that. But, in the meantime, really make sure things are surfaced. And even in the winter period, intermittently opening a window if you can also help. But it's an area that we will continue to work at, because it's not an area that is the expertise of public health. So we're engaging, other sectors.
Thank you. Dr. Tam has to now leave, but the doctor and ministers will still be here, and we'll go to the phone for one question and then back to the room. Operator.
Thank you. Merci. Prochaine question, l'inaudible.
Next question from the Canadian Press. Since Dr. Tam is leaving, it will be Dr. New to talk about the aerosols. We've reached the point where we're trying to understand what you're talking about when you're saying forget about the 2 meters, just have a mask indoors all times. You're not making a link to aerosol infections. Could you please explain it as clearly as possibly and as scientifically as possibly the link between aerosol infection and the importance of being protected at all times inside, even if you're 2 meters apart? Answer rather. Thank you for the question. It's not easy. I'll try to repeat what I've said already. I think even back in July, I went into more detail on the state of science and evidence, scientific evidence. I like to give the analogy of cigarette smoke. We know that the virus is transmitted by droplets, but there's a whole range of droplets. There's big droplets that fall quickly to the floor when you sing or when you yell, but there are other smaller droplets that may stay in our environment for a few minutes and even for a few hours. I like to talk about someone who smokes as an analogy. If we're next to someone who's smoking outside, of course, the cigarette smoke will disperse much more rapidly than if we were in the same situation inside with a smoker in a restaurant, for example. So we have to be careful. That's why Dr. Tam and I have been saying for several months now, you really have to avoid the 3 threes. In French, I use a different acronym, of course. You need to avoid close contact, closed spaces, and crowded places, because aerosols can be a source of transmission. Now, scientifically, we don't know the proportion of cases that are transmitted by the different methods, by droplets or aerosols, by different size droplets, additionally. So that's why we have to be very practical in our approach, given our experience. By following proper public health measures individually, we were able to flatten the curve. It's through hand washing, limited physical contact, and hand washing that we do so. I said several times, rather, in the spring, that when public health followed contracts, that is, did contract tracing, that in the spring there were perhaps 3 or 4 cases that followed through this contact. Today we're talking about 30 or 40 cases. So public health is doing contact tracing. We're starting to see the consequences in hospitals now. So I'm not sure it's just a question of aerosols or no aerosols. What is the behavior that all Canadians must adopt as day-to-day habits to protect themselves? Does that answer your question?
Return to the room.
Oui, bonjour, Juliane Lapointe de Radio.
Parliamentarians' safety outside of Parliament. Can you tell us why it is so important and what you concretely need to make parliamentarians feel more safe, given the recent events in the area? Answer, I think everyone, parliamentarians, as well as security officials, have been concerned the last few weeks given recent incidents. For example, what happened to Mr. Sink just outside of Parliament. As a parliamentarian and a colleague, I was quite worried when I saw the images of this event. And this concern is shared by all parliamentarians. The government and the RCMP have a responsibility for safety outside of the House of Commons. We always need to analyze threats and ensure that parliamentarians are safe, including parliamentarians from the opposition parties. Follow-up question. Mr. Baines, would you like to add anything? Answer. I'll echo what Mr. LeBlanc said. Sorry, I forgot to take off my mask. Mr. LeBlanc spoke with Mr. Singh, the NDP party leader. I think it's important to have a strategy that protects the safety of parliamentarians, MPs, and other people on the Hill. This is a necessary strategy, unfortunately. I hope that we'll be able to come up with the solutions for security issues.
With CBC. Dr. Tam was talking about her hope that there could be a vaccine in the first quarter of 2021. And I'm just wondering if you could elaborate on that. What's giving you that hope? And are you talking about one vaccine, more than one? Is there a candidate you see as more promising?
Well, as Dr. Tam and I have been involved with obviously discussions with our colleagues in Health Canada to see how it's going in terms of, quote, the regulatory regime, because I think the first thing we want to stress is that whatever vaccines get approved in Canada, I think Canadians can rest assured that they will have passed through, the strictest sort of regulatory regime to make sure that they're both safe and effective. There are a number of candidates which are, as they say, farther along in the pipeline. And as the Prime Minister has also stated, the sort of the more promising ones, the early ones, which we anticipate because they're finishing off their their phase 3 trials right now, and certainly the experts will be looking at the evidence and so on. But if those get approved, they are more challenging from a logistical point of view. That one of the vaccines, as the Prime Minister stated, needs to be kept at a temperature of minus 80 Celsius. Certainly, that's not the way most of vaccines in Canada in the past. In fact, none of them have ever been obligated to have that kind of cold chain, if you can call it, in terms of logistics. And so we have to obviously, working with our provinces and territories, work out the mechanics, in terms of buying the right kinds of freezers, et cetera, the transportation mechanisms, et cetera, to be able to assure that if that's the first one out of the pipeline that gets approved and be able to offer that to Canadians, that we're able to do that in a in the most effective and efficient manner. So there is, I think, as Dr. Tam and I stated in our opening remarks, we're optimistic, but certainly cautiously optimistic. And so besides the first couple, which might have some logistical challenges, I think that some of the other candidates, maybe a bit further behind, might be of what we call the more traditional type in terms of being maintained between 2 and 8 degrees Celsius, and those ones certainly we can anticipate using the existing mechanisms for distribution within the provinces and territories.
How far along would we be then in terms of with that one that needs to be kind of super chilled? how far along would we be in terms of acquiring the equipment we need to hold on to it and distribute that?
Oh, the work's actively going on. That you wouldn't believe what's happening behind the scenes. Certainly, lots of folks are working on it within the federal government, between federal departments, but also with their, I would say, their technical operational counterparts in the provinces and territories. I've been party. I've observed some of those discussions. Very technical in terms of, as the Prime Minister mentioned, we're looking at things such as syringes, how they're distributed, who's buying them, etc. I think one of the important things we want to state is that the Canadians can rest assured that the vaccines, whenever they become available, will certainly be free of charge for every Canadian who needs and wants it. Certainly, I think it's a choice we would anticipate most Canadians will make, not just for their own health, but also protect their loved ones and others. Certainly, I think the sort of the machinery behind the sort of the rollout of the vaccines is well underway. Certainly, we recognize there's lots of work ahead, but certainly at this point things are on track. Should we have a vaccine that's approved, I would say sometime early in the new year.
Stephanie Levitz, the Canadian Press. In October, you were reporting average daily testing numbers of between 70,000 and 77,000. But this week, that number fell below 61,000. And I'm wondering if you can explain why and what impact that might be having on the spread and containment of the virus.
Well, I think if you look at the testing, and it's true that over the past few months, the testing capacity has increased across the country, and certainly I think we're at a point that the provinces and territories, I think, are in a good position, that they are able to, for the most part, I think, test, as they say, the right people with the right test at the right time. I can't speak to actually what's happening on the ground. We certainly get data from the provinces and territories on a regular basis in terms of their testing numbers. What I think is important to understand is that I think in some provinces in the past few months, I think that there was maybe an approach, a strategy of offering testing to everyone, regardless if you were actually at risk or symptomatic and so on. And I think people are now recognizing that the best approach could or should be more focused, that it may not be the best use of resources, and it may actually sort of slow down the testing for those who actually need it. And so, as you can see, with the sort of the introduction of, I would say, more testing technologies, certainly we've put out guidance that shows that every testing technology that comes aboard needs to find its place in terms of an overall testing strategy. So, as we said several times, the gold standard is still PCR. Most tests are still done where people get a swab done and then it goes to a laboratory. There might be a sort of a delay, so to speak, in terms of reporting a couple of days. What's now been introduced, and you've heard it obviously in the past few weeks, is that we now have more what we call a rapid turnaround test for the PCR technology. And that's great because certainly that's been a challenge in some of our northern, more remote, isolated communities. By having that test available for those who actually need to test because they're symptomatic, you want to get the diagnosis right. That PCR technology with a quicker turnaround time, where you don't need to transport the samples to, quote, a laboratory down south, is now available in the north. The newest sort of kid on the block in terms of testing technology, and this is the one that I think is under a lot of sort of discussion within the provinces and territories, is the antigen test, which we know is not as, say, maybe reliable or gives us accurate results as the PCR test, but certainly has its place. And so this is the point where in some settings where you might be doing more regular testing of asymptomatic individuals, people, let's say, in, let's say, meatpacking place. But certainly if anyone were to test positive using an antigen test, we would then recommend that it's followed up by a confirmatory PCR test. So I think we can't get hung up about the numbers per se. It's all about the types of tests used, who's being tested, and so on. The one thing we're also looking at is what we call the sort of the positivity rate. That by itself, I think, is only one of multiple indicators, but that gives you an idea in terms of the degree of community transmission. So certainly at the international level, also in Canada, we look at jurisdictions. Look overall for Canada, we're at sort of 4.7% positivity rate. That's higher than it was in the summer. I think we'd like to get it lower. But certainly what we've seen is that in certain parts of the country,
If you have a positivity rate over 10%, that's very concerning, and I think that's even been used as a sort of a criteria for indicating that a certain region in a certain province might be, quote, in a red zone.
I have one question for Minister LeBlanc. On the Board of Internal Economy's decision to hire, I guess, personal bodyguards or security force, some other kind of security force for MPs, I wanted to know, have you looked at the cost? What is the estimate of the cost of that provision, given that I gather it's not going to be RCMP, it would be something else? And have threats to MPs increased during pandemic?
So obviously, we don't discuss security measures or steps that are taken by professional security authorities to ensure the safety of people, for example, parliamentarians. The Board of Internal Economy is obviously on an ongoing basis looking at advice in terms of what can be done to ensure the safety of people who work on Parliament Hill, people who might visit, and obviously parliamentarians themselves. So those discussions are continuing. They have taken place for as long as I've been on the Board of Internal Economy. But the one thing the security professionals tell us over and over again is the most effective security measures are those that aren't discussed publicly.
Since the pandemic.
I'm sorry, Tana, can you repeat the question?
Just could you speak to, has there been an increase in threats or a reason for MPs to feel less secure?
Again,
Et en français aussi, s'il vous plaît.
Again, we think that members of Parliament should always feel secure in the discharge of their responsibilities. It would be unacceptable for members of Parliament to feel insecure when they're undertaking their important responsibilities. And the same thing would be true of people who work on Parliament Hill. So those discussions, those reviews are ongoing, and they're done by professionals with experience in how to mitigate any particular threat and what steps are appropriate to take. So in that sense, that work has been ongoing for a long time. En français, évidemment, la régie interne de la Chambre.
In French, obviously, the Bureau of Internal Economy of the House of Commons, and I've been a member of that committee for years now, this committee has always been concerned by the question of security. What needs to be done to ensure that all parliamentarians are safe, as well as everyone working on Parliament Hill and visitors to the Hill? The discussion with security professionals, including the RCMP, has always been something that the Bureau of Internal Economy and the speakers of the two houses, the House of Commons and the Senate, have taken very seriously. I'm confident of the measures already in place, and the security professionals have always told us that the security measures that are the most effective are the ones that aren't discussed.
Thank you. The conference is now ended. Please disconnect your lines at this time, and we thank